Jonathan Mackley's with FortisPay. Today we're going to talk about stored credit cards and bank accounts on file. So within the Fortis system, you can store credit cards or bank accounts on file securely. Now, the nice thing is when you do it through our system, we are PCI compliant. So we take all of that compliance off of you. We talk to offices every day that are storing credit cards either on a piece of paper, in an Excel file, or worst of all, sometimes on like Google Doc online. You do not want to do that. If you are caught storing credit cards, it's $5,000 per card that you have written down. So it can be a lot of money and it could bankrupt an office. So we don't want to have you guys do that. Nice thing is we can take that liability off of you. So how do we store credit cards compliantly? We often get asked that question. We use a process called tokenization. It's a fancy word for basically saying we replace the 16-digit credit card number with a 16 alphanumeric token, or just letters and digits that don't mean anything to anyone. So if someone were to break into our system, we don't actually store credit cards in our system. We store these alphanumeric tokens for every single credit card, and we pass that data to Visa, MasterCard. And then they know what the credit card number that is associated with that. We run the transaction, they pass back an approved decline to us. So we can store those credit cards or bank accounts on file securely for you. You can run one-time payments off of those stored credit cards or bank accounts. You can nickname those cards. So if a patient wants to label it as an HSA card or their recurring card or their products card, you can do that. And you can store multiple cards in our system. So if a patient says, use my HSA card until that runs out and then use this second card, you can label it accordingly. And you can store as many credit cards or bank accounts on file for a patient as you want. One of the best things about that is when the patient comes in, they don't have to do that motion of pulling their credit card out each time. And psychology tells us that when someone doesn't have to do that, they feel less pain of making that payment. And we really want to remove any friction that a patient has associated with making a payment, and or anything that's going to stop them from potentially making a payment or purchasing something that's going to better their health. So we want to make it easier for them. It's kind of like a gym membership, right? Or if you have your card on file at your gym and you can buy a protein shake there, right? And it's nice and easy. We want to make it that easy for them. So even if it's not something you've done in the past, try and make it something you're doing in the future, where you store your patient's credit card and now they don't have to bring that credit card or take that motion each time of bringing it in. If you have any questions about it, please feel free to reach out to us and we'd love to answer those questions for you.